Dear community, Jochen talks to Professor Dr. Eyal Zimlichman. He is the CMO and Chief Innovation Officer of Sheba Medical Center, and they talk about ARC.
I heard several times lectures from you about Sheba Medical Center, digitalization, medicine of the future, and so on. Give us an explanation about ARC.
So ARC is a concept. It's not an innovation center. It's not a physical space. It's a concept that is aiming to have a real meaningful impact on healthcare in the next 10 years. To get there, we think you need to focus on four things. One is digital health. Digital health is going to be the main transformation agent, and it would have huge impact on how healthcare would look like 10 years from now. And when I say digital health, it's the wide spectrum of digital health, from artificial intelligence and big data, to precision medicine, to virtual reality and augmented reality, to telemedicine, of course, which is going to play a critical role in the future, and to innovations, digital innovations in surgery. The second element of ARC that's important to focus on is creating an open innovation environment, especially when it comes to startup companies. Being able to be startup friendly, providing a startup friendly environment so we can see accelerations of development with startup companies. For example, access to data, for example, access to clinicians, access to patients, and doing a proof of concept. You have to have the right infrastructure to allow that to happen, and of course the right mentality, not to ask what's in it for me, but how can we help in creating the innovations of the future with the startup companies. The third element is global. We have to think globally in innovation. Everybody brings to the table what they are strong at, but together we make a powerful team. And the globalization, globalization partnership is critical. So within ARC, we have many of the world's most famous academic medical centers, like Stanford, like Mayo Clinic, like Mount Sinai, and Brigham and Women's, and Mass General, and others. A lot in North America, but we're looking to have more join us from Europe as well. And finally, it's the infrastructure. And infrastructure has to start with the policies and regulations that govern how we do things. What are the rules by which we work to increase innovation? That has to support a very accelerated mode of innovation. So that has to be in place. The infrastructure for data, which is critical. Even if we have a lot of data, we need to make sure we can actually use it. And that is critical. And finally, it's the physical infrastructure, where we're going to meet to work together and innovate, to think about the problems and the solutions that we're going to need. The different stakeholders, the startups together with the large strategic industry partners, together with the academic medical centers and the universities, we get together and we work together to innovate.
Yeah, I'm really impressed about this. You named virtual reality. What do you think will be this role in the future from VR?
So VR has the potential to change a lot of the things we're doing. For example, it comes to mind a lot, training. Mm-hmm. Training staff using virtual reality, doing a surgery before we operate on a real patient, doing the surgery before in a simulated environment using virtual reality or augmented reality. That is one thing. There already is evidence that shows that we could improve our outcomes using that kind of training. Also for rehabilitating patients. Patients in a simulated virtual reality environment can go through rehabilitation, which is much cheaper and with much better outcomes, but also a lot of fun for the patient. And finally, for treatments, for treating patients, whether it's for pain, for anxiety, for depression, for other things as well, but we know for pain that if you use virtual reality, you could minimize the drugs that you provide today for painkillers, like opioids. And there's been some evidence that you could reduce opioids by 30 to 40% by using virtual reality. Of course, there's no addiction to virtual reality. They're much cheaper. There's no side effects. Everybody loves it. And I think we need to see much more use of VR everywhere in medicine.
And finally, give me please some aspects on the OR of the future?
So there's a long-term version and a short-term version or vision. The OR of the future is going to change completely through digitalization, much more than it's going to be changed by devices or anything else. We see, for example, artificial intelligence play a critical role with the surgery of the future. The surgery of the future will be either robotic enabled or would be done in laparoscopic fashion or through scopes, which means we have a digital image and we can work with that digital image to create decision support systems that allow us to make better decisions inside the surgery. Less complications, better outcomes, better disease-free survival if we're treating patients with cancer, for example, through the decision support provided by the AI. On top of that, introduce robotics with AI that will allow us again to treat and operate on patients we cannot today because of limitations. And finally, introducing virtual reality and augmented reality to have better navigation of surgery, to understand better how the patient's organs are and if there is any variance in vasculature, for example, or any other anatomy. All of that will be enabled through virtual reality and augmented reality. Put that all together, we're going to see an operating room that will be much more efficient. Times of surgery will shorten considerably, outcomes will improve considerably, and with telemedicine, we will be able to operate on patients that are far away from us. So imagine the academic medical center having the best surgeons in-house operating on patients that are on the other side of the world. Regulations would approve that in the not so distant future. So this is where we're going.
So medicine will change dramatically. But how will you teach the medical students in your hospital?
Specifically around digital health?
Yes.
Well, of course, we start by introducing them into this topic very early on. We teach them about innovation. We teach them about digitalization. The young students are more eager to that. They're already much deeper into digitalization than we are. So for them, it's more natural. If they grow up in an environment that is fostering that provides funding and grants for innovation, that promotes people that are innovative, where there are maybe financial benefits for innovators, all of that would create the next generation of doctors and nurses and other healthcare professionals that would be pushing the digitalizations forward. It's a different generation.
Dear Eyal, thank you very much again for your explanation. Fantastic. And I'm absolutely sure that the viewers also like this very much. Thank you.
Thank you very much. Thank you.